Banner University Medical Center Phoenix has a new neurological service line that works as a one-stop shop for critically ill neurology patients, especially those suffering from strokes and traumatic brain and spine injuries. To learn more, we welcome Dr. Khalid Al-Sharbini. He's neurologist at Banner University Medical Center Phoenix. Good to have you here, doctor. Thank you for joining us.
Thank you. Appreciate it. Thanks for having me.
So this is what's going on here? Is this like an all one-stop shop for really critically ill folks?
Yes, so we created, we put together a team of what we call a comprehensive multidisciplinary team that includes providers who have the specialty training in the field of neurocritical care, in addition to all the team members that help provide the most comprehensive and innovative care for those patients. That includes pharmacists, nurses, physical therapists, behavioral therapists, occupational therapists, nutritionists, to provide that care that needed for these, basically the sickest of the sick that comes into the ICU, in addition to all the innovative technology that we put together in one place that can provide that comprehensive neuromonitoring.
So in the past, traumatic brain injury might go one direction and a stroke might go the other direction, and you would have a little bit of cross current, but now everything is in one place?
Yes, in addition to, we were able to provide that the team that cares for those special patients, in addition to provide the technology and the innovation that can monitor those patients, because those patients they come in and with the worst part of their illness, especially when they come in with the severe brain injury or the severe stroke, and then we provided all the resources that can provide the treatment but also monitor the injured brain, so we can provide specific treatment for that particular patient at that particular moment.
So, an example, someone comes in with a severe stroke. How much multidisciplinary activity goes on there?
So immediately, if you come in with a severe stroke, you already have 4 teams involved in the care of that particular patient. So immediately, the emergency department physicians, we have a comprehensive stroke team that has the specialized neurologists who are trained in stroke, in addition to the neurosurgeons and neurointerventional radiologists that provides the treatment to retrieve the clots from the brain, and those patients comes to us in the neuro ICU to provide the post therapy. So all these teams under one umbrella for the Banner system.
Is this kind of rare in the medical industry to have everything under that umbrella?
It's usually fragmented, so there's only the most comprehensive centers in the United States that can provide that care, especially with the degree of the innovative technology that we brought to the Valley.
Yeah, when did this start then?
We've been preparing for it for a year in terms of recruitment, establishing the technology. We went live in May 6th.
Yeah, and how many patients so far?
A lot of patients.
A lot, even starting in May, huh?
Yeah, because the patients are there. It's just we're providing the one-stop shop and start using the technology.
When reading about this, I know the results, obviously you have different results with different patients, but there was one patient that had almost continuous seizures. It sounds horrible. Continuous seizures, and you guys got involved and things worked out pretty well. Talk to us about that, like deep brain stimulation or something along those lines?
So one of the things that we can provide is that really the continuous EEG monitoring and also the expertise of management of the most severe form of seizures, what we call the refractory status epilepticus, which is continuous seizures one after another that doesn't respond to medication. But we have, one of the things that we have also in our center is a comprehensive neurosurgery program, and as well as we're the highest level of epilepsy care that we can provide. We're a level 4 epilepsy center. Our teams meet together and try to ask the questions for this particular patients. What are the innovative devices out there that when medication fails, and we were able to provide the deep brain stimulation for that particular patient, which is an extreme rarely used in these scenarios, but it was effective, and actually patient did great for the first time in his life that was seizure-free.
Yeah, and this kind of collaboration, I would imagine, would be the future of medical care, would it not?
Absolutely. I mean, the collaboration and what we call the precision medicine, that we know that patients behave differently and they have different way of reacting to medicine, and that's where we rely on technology and artificial intelligence and all of these new tools that we're using to provide that specific care for that particular patient.
Last question. You got about 30 seconds left, so we're running out of time, but we have a lot of doctors in here, cancer doctors, Alzheimer's doctors. Is stroke, seizure, brainstem, these kinds of things, Are the advancements there as similar and as encouraging as they are in some other fields?
Absolutely. I mean, if we have the same interview 5 years ago, I would have told you, unfortunately, we only have very limited option for strokes. Now we're treating strokes more than 24 hours of the onset, and also the advancement that happened in the care of epilepsy with all these devices and all these, and similar with TBI, that was not there 10 years ago.
So it is similar to those other fields then?
Absolutely.
Yeah. Well, Doctor, thank you so much, Dr. Khalid Al-Sharbini. Again, Banner University Medical Center, Phoenix. Congratulations on this new one-stop shop for some very sick folks. Good to have you here.
Thank you. Appreciate it. Thank you.